This video is for basic facial, so we're going to start as if we just arrived at work. And the first thing we do when we arrive at work is we wash our hands. So we wet our hands, we get a coin-sized amount of liquid hand soap, and we wash our hands down to our wrists. And then we wash the back of our hands down to our wrists. We wash our fingers, and we wash the backs of our fingers. We wash our fingertips and nails. We wash between our fingers, we wash between our fingers and our thumbs, we wash our thumbs, we wash our wrists, and we do all of that interlocking wash for a minimum of 20 to 30 seconds. And we thoroughly rinse it under the water. We grab disposable paper towels or a clean towel, dry everything off, throw the paper towels in the trash. If it's a towel, it goes into a closed container until it's time to do laundry, and then we find our hand sanitizer, 70% ethyl alcohol, and we sanitize our hands. And once our hands are thoroughly sanitized, we can prepare our workstation and room for our clients. So we will disinfect our workstation, bed, and equipment using a disinfectant wipe following manufacturer's instructions. We're going to check our equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, storing in a clean, closed container. We will turn on the hot cabbie and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. We'll fill clean steamer glass with distilled water, and we're going to preheat the steamer. We're going to dispense products needed for the service according to skin type and client's needs as follows. We'll prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. We're going to close the lid to the product and set the portion cup tray on the tray. We're going to drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. We'll place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. We will lay a hairnet and headband on top of the first towel, along with a rolled towel, to support the head and neck of the client, saving the third towel to lay across the client's décolleté. So we'll have done all of that, prepare the bed, have all the things on the side, have that hot cabbie turned on, the towels inside, the preheating the steamer with the distilled water. Everything is done. So on this side over here, I have my tray that has all of my items prepared, and I'm just going to review what I have on my tray. So I have hot water, I have toner, I have obviously makeup remover and astringent. I have a pair of disposable gloves for the time when I do extractions. I've got 4x4s, 2 squares, and cotton rounds. I've got this disposable scoops that are single use. I've got wooden stick Q-tips for extraction. I have cleanser, I have exfoliant, I have massage product, I have a mask, I have eye cream and moisturizer, and I am good to go. Now, everything that we do ahead of time, obviously, is preparing for the client, and we're doing all of that to be timely. We'll be ready when the client arrives. We may not be able to dispense all the products that are appropriate for the client based on the client's needs that we don't know yet, but we can certainly have everything out, all of our accessories, etc. And which made me think of one thing that I need to get. I need to get a implement. I need to get a brush to apply my mask. So I'm going to do that, and I will be right back because I'm doing everything before my client gets here, of course. Sorry, that pause. So now I officially have everything that I need, so that way I can stay on task with my client and her appointment, my timeline, her timeline for both of our schedules. which of course is professional inappropriate. So what we would do now is the client consultation part. And this is really a very light overview of what a client consultation would consist of, and I will go into detail with a few things, but note that client consultation is probably the single most important part of your appointment. So giving that the appropriate time allotted to get to know your client and to learn what you need to learn is critical. So we're going to review that before the basic facial, and note that this is probably a very light, quick touch. So approaching my client, I will always have clean hands. Just so you know, I just washed my hands upon work and arrival, then I've disinfected and cleaned my workstation. I would be cleaning my hands to meet the client. I'm going to clean them again before the service starts, but I always want to note that I am approaching the client with clean hands. So we're going to go to that client consultation part. We're going to greet the client and escort the client to the work area. We're going to determine the client's preferences and assess the client's needs. We will assess the client's skin by performing a skin analysis with our eyes, of course, to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We're going to assess the client's consultation form for any medications and products used within the last 72 hours. We're going to consult on any known allergies. We're going to consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care, we'll assess if the client is prone to cold sores or fever blisters. We're going to assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from the above contraindications, the student can move forward with the procedure. But just noting that so much of that is just a slight overview. So obviously ingredients and allergies matter. You need to make sure you're not going to use anything that they may be allergic to. The other thing, they're talking about medications. Medications can change the skin, change it, whether it's thinner or thicker, how it's going to respond to an ingredient. So take the time with that. You're going to obviously want to know that their medical history. You're going to want to know really everything you possibly can. Lifestyle, diet, all of these things are going to go into a huge grouping about this service. We're going to talk about a basic facial. So today, luckily, my client doesn't have any of those so that we can move forward. But don't just skip over that. If you really need to know something, call someone, look it up, do what you need to do. That's the most important. You are their skin expert. So you want to make sure that you're building this great relationship with your client and you're taking the best care of them so that you can exceed their expectations and really help them achieve the skin goals that they are going for with you. So it's really a team effort. So after that, you're going to get your client comfortable. You're going to need to give them privacy because you've made the facial bed, you've laid out the drape that they're going to need to change into. So you're going to leave and let the client change, and then you'll come knock on the door when they're ready. When they're ready for you to come in, you can. So we're just going to get them even more comfortable. So at this point, our client is laying down, and what we're going to do is we're going to get them a little bit more support. So we're going to take a rolled towel, place it underneath the neck. We're going to take an extra towel to lay across the décolleté. We're going to put on a headband, or hairnet rather is what I have, to keep the hair out of the face. And then you're going to wash your hands. So you're going to go quickly to that sink. You're going to make sure the client's comfortable checking in, and you're going to wash your hands. Get that coin-sized liquid hand soap and wash your hands down to the wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash your fingertips and nails. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs. You're going to wash your wrists. And you're going to do all of that proper wash for a minimum of 20 to 30 seconds. And then you're going to thoroughly rinse underneath the sink. You're going to dry those hands off. And when you feel like you've got a nice dry, you're going to thoroughly rinse those hands off. When you got them nice and rinsed, you're going to grab disposable paper towels or a towel to turn the faucet off with. Dry your hands. If it's paper towels, they can go in the trash. If it's towel, it's now dirty and it just goes in that closed container until time for laundry. And then you're going to get your hand sanitizer, which for this has to be 70% ethyl alcohol, and you're going to do all those same motions while you're sanitizing. Once your hands are sanitized, you can start the basic facial. And the first thing that we're going to do is remove makeup. So we're going to get makeup remover with some cotton rounds. Some clients will use more, some clients will wear less, so you just take your time here and do what you need to do to get the makeup off. Then we're going to do the first cleanse of the face. This is just the initial cleanse to try to remove that makeup, etc. And then when you're finished, you will remove that first cleanse. And then you're going to do that further investigation so that you can do the good skin analysis with your magnifying lamp or your Woods lamp. So you want to cover the eyes and protect them because you're going to go in with a brighter light. So we're going to bring in a magnifying light or magnifying lamp or Woods lamp, which I don't have, so I'm just going to pretend to bring it over and turn the light on. And this is where you're going to take a minute and really do that proper skin analysis. for many reasons. So she had discussed with you some things that she was concerned about, maybe some signs of aging, some fine lines and wrinkles around the eyes, some dehydration. She's concerned about at the area around her nose and mouth. You're going to look at different parts of the face for different things. Obviously, she's going to be concerned about her thoughts, but you're also going to look for everything. So you're looking for excess sebum, you're looking for any congestion in the skin, maybe around the chin area. You're going to look for redness or any kind of like hyperpigmentation. You're going to be looking for texture. You're going to look, if this is your first appointment or your millionth appointment with her, it doesn't matter. You're going to look at all of her freckling or moles or anything like that that she may have, because you're going to be recording all of this evaluation and information. Whether you use a software system or a client card, you need to make sure that you're keeping really, really good, accurate records of not only the service that you provide, the products that you use, but then his or her skin, so that if you have any changes or you notice any changes, that you are able to then, if necessary, refer them to a physician if you feel like that's the course of action, or also just to notice changes, maybe whether it's seasonal, hormonal, etc., that things that you can talk about, because you're trying to be her best teammate to get those optimum skin results that you're both going for. And she's with you X amount of time a month, but she's with herself all the time. So you're going to be able to address with this skin analysis maybe some great products, recommendations at home, and then also maybe some service recommendations moving forward. You are mapping out a plan. It's not a one-stop, quick fix, instant gratification necessarily. It may take a while. So the beautiful thing there is you've taken that time to do it, and you're making a record of it. So once you're finished with your skin analysis, looking through either the Woods lamp, the magnifying lamp, or both, you're going to turn the light off and take it out of the way, and then you can uncover her eyes because now she's safe. And you're going to go in with that second cleanse. So you definitely saw that there was still debris and dirt on the face, and so now you're going to go in there and get it all extra, extra clean. And taking the time to do it so that you really feel like the skin is prepared for the facial. So today we're going to do 3 cleanses for sure. And you may not always have to do that, depending on the client. And then you can remove that second cleanse. And then we're going to do our third and final cleanse. We can remove that. So she should be really good and clean at this point. And we're gonna then follow with toner. And with my toner, I'm gonna make sure I've got a spray toner that my nozzle does not come into contact with these 2x2s when I spray. And then now I'm going to exfoliate. So what I'm going to do first is I'm going to take about a pea-sized amount of exfoliant, and I am going to spread it around the face, avoiding, of course, the mouth, the nose, and the eye, like we always do. And then I am going to massage that product in for 1 to 2 minutes. So you're always going to follow your manufacturer's directions. But I'm going to take a minute here to do that before we move to the next step with the exfoliant. And then once you've done that massage, we're going to discuss what would happen next, because I don't have these machines either, so we're going to review what we would do. So we would retrieve our facial steamer and turn the steamer on. We would position the steamer next to the facial bed, making sure that it is facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, you're going to position the steamer 16 inches over the client's face and aimed at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Remove the steamer from the client's face, return the steamer to its previous location for disinfection. So we're basically going to get that steamer that we preheated and that we put the distilled water in and bring it over to the facial bed. And then as it's facing away from the client, we turn it on. We let it get to that even outflow of a mist, and then we're going to turn it 16 inches over the client's face. We're going to position it there and let it emit the steam over the client for 3 to 5 minutes. We don't have it, and for the sake of the video anyway, we're going to pretend that that 3 to 5 minutes has elapsed. Then you turn the steamer away from the client, turn it off, and go ahead and put the steamer back where you got it in order for us to move forward, and then you'll disinfect it later. So then you would go to your hot cabbie, which we also don't have, to retrieve a steam towel. So I'm going to pretend like my towel's a steam towel, and I'm going to shake it out because I got it out of the hot cabbie and it's super hot. I'm going to test the temperature on my wrist until it's comfortable. Then I'll test it on my client's collarbone. She says it feels great. So then I'm going to take this towel and I'm going to lay it on her face. I'm going to leave the nose out so she can breathe, and let that steam towel rest there. And it'll start to cool down after about 20 or 30 seconds. You'll feel that, and you'll know then it's time for you to take it off the face. Removing your exfoliant, of course. And then you want to make sure that your hands are really dry, because you're going to be putting on your disposable gloves so that you can do extractions. And there's a couple ways to perform extractions, which we'll talk about. We're just going to put our gloves on first. So you could soak 2 cotton rounds in astringent, and you could wrap them around your fingers, and you could perform extractions working your way around the cotton rounds, and then you toss it. Or you could do the method that I'm going to do today, which would be soak cotton rounds in astringent, and then you'd be using 2 at a time for each extraction, and then you toss it, and then get 2 more and toss it, etc. So that's what I'm going to do. My client doesn't have a lot of need for extractions. She does have some congestion in the chin, so we're going to address that and go ahead and perform the extractions there that are needed. And with extractions, you do not want to do this for more than 5 to 7 minutes, as it could be uncomfortable. You could also bring that magnifying lamp back in, which you probably would want to do or need to do. I would not be doing that because I don't have one, but of course you would need to cover the eyes again before you even think about doing that. cover the eyes during extractions and then bring that magnifying lamp back in. So that's a good thing to note. This is her last extraction right here. And then you would take off your disposable gloves and throw them in the trash. So all that stuff goes in the trash. And then we are going to tone. So you exfoliated, you did your extractions, now you're gonna do your toner. And once again, my mister is not gonna come into contact with my 2 squares. And then the beautiful thing is after she had her extractions, she now gets to have a massage. So we will be retrieving our massage product. And one thing to note about this is you want to make sure that you get enough of your massage product on your hands before you start the massage, so you don't have to leave your client's contact with your client's skin, so that the client can truly relax and you will not be making it awkward or uncomfortable. Your hands won't be leaving the client once the massage starts. So I just spread out my massage product. Before I start the massage. And one thing to note about massage, if they have severe acne, this would not be what you would not be performing a bunch of massage. That would only irritate and spread the bacteria. you can remove your massage product. And then you're going to apply your mask. And I'm going to use a brush to apply my mask, of course, avoiding the eyes, the nose, and the mouth. And you would read and follow manufacturer's directions for your mask as well. Once again, we are in a video, and we are going to pretend that 5 to 10 minutes, which is what our mask is supposed to be left on for, has elapsed so that we can move forward with the rest of the basic facial. So mask, follow those directions from the manufacturer. We're going to say that this was 5 to 10 minutes. You could gauge that based on the client and the client's skin, and that time has elapsed, so we are going to then remove our mask product. So that's what we're going to do right now. And once your mask is removed, you're going to tone. So we're going to do a final tone. Once again, I am not going to come into contact. My nozzle is not going to come into contact with my cotton rounds. And now we are going to apply skincare, and it is daytime. My client's on the drier side, so I'm going to be using an eye cream that is lightweight yet moisturizing, perfect if she does need to go back to work and put on any makeup. I'm going to be using a moisturizer that's very hydrating with a great SPF, so important. She's already said that she's taken that SPF moisturizer home. She's been really needing that, and nobody should be out without SPF. And so we're going to start with our eye cream. We're going to take a very small amount, and we're going to apply it with our ring fingers, the most gentle fingers on the whole entire hand, tiny little bit, and we're going to tap it on the zygomatic arch and the brow bone. And then we're going to get that moisturizer, once again, hydrating, SPF, physical block, 30, all the great ingredients. Very high zinc oxide, all the good stuff. So we're going to apply it to the face. We're going to apply it to the neck. We're going to apply it to the décolleté. In case that's exposed, we are going to make sure if she has short hair and her ears are out, we're going to apply it there. We've definitely reviewed the importance of an SPF. And then we are going to apply a little bit of a lip product as well. Who doesn't want gorgeous moisturized lips before we present the skin? And then we show her how amazing she looks, and she's blown away. So we know that she's happy, and we're going to give her some privacy so that she can get dressed, and we'll meet her back out in the client consultation area. So what we're going to do now is spend a little time with her, get her some water, get her moving and grooving on, excuse me, not a real client, but you know, of course we would do all the right things. We are going to go over maintenance and aftercare. We had discussed some options based on what we saw during service, that we've got some recommendations that we're going to go ahead and get her booked back in for, that she's talking to me about, that we confirmed during this facial. This was our first appointment, and now we kind of have a plan of action, and she's excited and she's thrilled with these results that she's going to be back. And then what we're going to do from there too is get her products, her take-home products. Remember, she's at home more than she is with you, so we got to make sure that she's doing the proper things at home, and that we've gone over all that and she knows how to use it, and then we get her out of there. Then we've got another basic facial coming in, so we've got to get back to our room and get it ready. So when you get to your room, the first thing that you're going to do is see if you've missed any single-use items that need to go in the trash, and you're going to toss them. You're going to find these implements that you've used that are now dirty. You're going to put them in a closed container labeled to be disinfected. You're going to identify a proper cleansing agent. You're going to read and follow manufacturer's directions for mixing and usage. And then you're going to completely wipe down your workstation and area with that cleaning solution to remove any debris. You're going to take all of those linens prior to this cleaning part, and you're going to put it in a closed container because they're dirty, like your sheets, your bedding. You've already done that. Until it's time for laundry. Then, of course, you do the cleansing agent part. Sorry, I didn't mean to leave out the linens. And then you're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. You're going to read those manufacturer's directions, of course, and you're going to have to put on another pair of disposable gloves because you're going to be using gloves when you use a disinfectant. You'll follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You'll disinfect electrical equipment like your steamer and store it in a clean area separate from other implements. And then you'll take those gloves off and toss them, and then that way you can do your proper hand wash so that you can get ready to set up for the next client. So you wet your hands at the sink, you get that coin-sized amount of liquid hand soap, and you wash your hands together down to the wrist. You're gonna wash the back of your hands down to your wrist, you're gonna wash your fingers, and you're gonna wash the backs of your fingers. You're gonna wash your fingertips and nails, you're gonna wash between the fingers and the thumbs. You're gonna wash your thumbs, you're gonna wash your wrist. You're gonna do all of that cleaning for a minimum of 20 to 30 seconds. Then take the hands under the water, really give it a proper rinse. When you feel like they're rinsed thoroughly, grab either paper towels or a towel to turn the faucet off. Dry your hands completely. Paper towels go in the trash. The towel would go in with that other dirty linen with a lid until it is time to do the laundry. Then to finish, you're gonna find that hand sanitizer, that's 70% ethyl alcohol, and you're gonna sanitize those hands. When your hands are sanitized, just as you washed, you can then go ahead and set up for your next client that's coming in. So that concludes the basic facial video.